I think it's June 8th, huh? I think we lose track. You know, the way this has been going, it's easy to lose track. Good afternoon, everybody. I can't believe it's after 12. Out in Indiana, it's 12 o'clock, right? But in California, it's about 9 o'clock. So really appreciate. We're going to be doing a little bit of dialoguing for most of this session. And we're just going to get going. And many of you, of course, we posted, and I should have mentioned it right here, but I'll mention it in a minute, about the visitation changes. But here you can see a picture of the governor at Lab Central, which has helped incubate a bunch of companies that have been responsive to the COVID crisis. You know, the numbers this week, you know, were 59,000 people tested, lower than our highs of 70,000, 69,000, but higher than recent week. And the number of cases have risen by 7,000. Actually, in the last time we looked at this, it's maybe there were shorter weeks. They seem to have rose this week a little more than the previous week. But the big difference is we had, I think, 302 deaths we had reported last week. It's at 517 this past week. But of course, from a few weeks ago, it's still 400 or more less people died. So it's still tracking okay. And I don't know how much of that had to do with the Memorial Day holiday and less testing, less reporting. I don't know. So, but we're still in good shape. The governor's moving ahead with further openings. So that's the news today. So here it is. Today, we really want to have a dialogue with colleagues from California and Indiana. It's you know, obviously California's much larger population, much bigger state budget. For example, I think the size of their cut is nearly the size of our state budget. Indiana has a similar population to the Commonwealth, but a different political context. Both states, though, have strong state leadership and political support. So that's why I wanted them on. Very different scenarios. And clearly, we're the third highest virus state, despite California being much bigger, right? And other states like Texas being bigger. So, you know, we're in a little bit of a different situation. It's good to learn from the other states. Jordan Lindsay has been the CEO of the Arc California since 2017. He it's a pretty good picture of him. You can see them out there rallying, keep the promise. Led California Association of Behavioral Analysts, and he led communication and policy efforts at Health Services at Home. And in 2007, he led government affairs advocacy and partners in policymaking, and has also worked as in the state assembly as an aide. And obviously the capital, California, is Sacramento. So he knows what's going on there. We've got Andy Kirby joining us, the Associate Executive Director of the Arc of Indiana since 2017. He also heads the foundation. In that role, oversees the Erskine Green Training Institute, which has a partnership with the Marriott, right? And you actually train people every year since 2017 or 16, Andy, in all kinds of hotel work, right? And right. It's pretty cool. And the state of Indiana gave them actually a grant to get the project going. I think it was $5 million. It was multi-million, whatever it was. And it's been successful. And since 2005, he's worked in our field in various roles and led a regional affiliate in Indiana. And he also has served, and he still may serve, as a CARF surveyor. So we want to start first, and I'll let Jordan, are you on at this point? I know, do we have to mute you? Hey, good morning. Good morning, Leo. I think we're going to let you talk first and then have Andy go. Just talking about, I mean, by the way, the last time I saw Jordan, I think we had a cocktail together.
We did,
yeah. In Louis, was it in Nashville?
Nashville, that was a good time. Yeah, it was good seeing you.
So, and it's great to see you. And yeah, talk a little bit about, let's start with both, first you, then Andy, talking about what it's been like in California, the kinds of issues you've worked on for a few minutes, and how people have fared in our community, our constituents, and, you know, our safety net.
Well, thanks a bunch, Leo. And to everybody listening, I just want to also let you know that Leo is definitely a mentor to many others, such as myself. So I've really appreciated his time with me. So in California, the crisis has hit us in a number of ways, and our community has been hit in a number of ways. It's similar to you guys. So specifically to constituents and families, I imagine it was similar. In the first couple of weeks, there was really crisis management. And as programs began to close down, and as especially day programs and congregate sites began to close down, then we knew that residential facilities were going to then be with clients and constituents for 24 hours a day. And we had to quickly find a way to make sure there was enough staffing for that time, enough hours for the residential services, and quickly find a way that the congregate sites, day programs, et cetera, could continue to be involved in the individuals' lives. And most importantly, we of course immediately wanted to protect health and safety of constituents and families. And so that was a primary concern also. We feel like we're doing a decent job at that. We haven't had the outbreaks and the cases in our specific disability community that definitely could have been, that was the potential at the beginning. And what I kind of want to transition to though quickly, that was definitely the mitigation at the beginning, and we continue to do that. We really see right now, it's almost becoming a bigger priority for us right now, is sort of the subsequent crisis as a result of special education being closed, programs and services being closed. And there is a real stress on individuals, stress, family stress. There is a deterioration in physical health, in mental health. And so we're trying to find ways, and it's a challenge, we're trying to find ways that we can continue to support families and individuals during this time as they're in this increased stressful environment. Parents especially are having to act as, for parents of children who are in school, as behavior therapists, or acting as speech therapists, or acting as everything right now. In addition to being parents and teachers, and kids and individuals may be having increasing behaviors due to stresses. So we're really seeing, and also there just doesn't seem to be, even though we're entering a reopening phase right now, for things like day programs, what that looks like is very, very, very unclear right now. And we haven't gotten a lot of direction from our state, and we're working on creating guidance ourselves. But there's just a lot of anxiety around that as well. How long is this going to last? What does reopening mean? Am I or is my child going to be safe? So there's still a lot of anxiety, and we're trying to find ways to support individuals and families through all that. Quickly kind of running down some of the other items. Workforce, we had the biggest challenge, we had a couple big challenges. One was immediately when the federal government passed the, what they said was sort of like the unemployment insurance on steroids, it created this strange conflict where if the workforce took the unemployment, they could almost be making more money than continuing to work and risk their health, risk their safety, do hard work. Nonetheless, we actually didn't see too many people go on unemployment. We also were able to secure retainer payments. So the state continued to pay programs at their average billing. And I worked with Leo, and we kind of were crossing notes on that. And so we were able to continue to pay the workforce during that time. The biggest thing is the challenge we had is finding ways for workforce, let's say day programs, to continue to be involved in supplement residential settings. So we wanted to find a way that residential settings could actually use the direct support professionals from day programs, but kind of in a borrowing them almost in a way.
They didn't want to lose them, right? They wouldn't want to lose them forever, yeah.
Right. The day programs didn't want to lose them, but they'd be more than willing to let their staff go and support the residential settings, but not on a permanent basis. So we quickly tried to figure out some kind of contracts and ways that we could let that happen. The state was sort of supporting us in that effort. And so it's working a little bit. It's still just very complicated. And access to PPE has been, was very challenging for everybody at the beginning. And we really felt like our community was at the bottom of the totem pole in terms of essential workforce when it came to PPE. And, you know, in some ways, yes, rightfully so, those nurses in emergency settings and in medical settings rightfully do deserve a certain priority, but we weren't even really being considered, and we had to fight and claw and scratch our way into those discussions at the state level as they were securing masks and other forms of PPE for essential workforce. We really had to actively insert ourselves in those discussions. Happy to say that our state council on developmental disabilities actually just secured about 2 million masks through the procurement process through our state. And so they're going to distribute that through their regional state councils. And so that'll be available to and that just happened a week ago.
Wow.
So it's evolving. It hasn't been, I mean, it's been a struggle for everybody, and it's been, I think, an especially struggle for our community.
And just before I ask Andy to jump in, how many constituents in your system? So we have a system of over 40,000 people.
360,000.
That's what I thought. Okay. Andy and I have a little bit of a different threshold than you. And then you said, in terms of the masks, what kind of masks? I have to ask you before I let Andy talk.
Yeah, most of them are the medical grade, but not the N95, but there is a percentage of them that are the N95 as well.
Okay, great.
Yeah.
I have an interesting postscript if we have time about the CDC and the whole clawing, and a recent memo that came out that was not the right kind of masks for our workforce, or at least a group of our workforce, and talking about cloth covering. So I was sort of shocked. Andy, Jordan, this is really good. And we're going to talk about the future too, folks. For those that are listening, no matter how uncertain things look, we're all talking about the future together and separately in our states. And I am going to ask both of you later about who your allies are in the state government. You know, if you were to pick one or two people that are, you know, as we have this dialogue. And because I think, you know, it's inevitable that you have to figure out allies in a crisis like this that are even maybe more connected than ever. So how are things in Indiana? And I'm assuming everything's fine, I'm assuming, in Indiana.
It's 75 degrees and sunny, so it feels good in Indiana right now. I guess that's a good thing. But good morning, Jordan. Good afternoon, everybody else. We're getting by in Indiana. And for those of you who don't know much about us, the Arc of Indiana and our network, we've got 43 local chapters. About half of them are provider, the other half are advocacy only. We also have 30 organizations that are connected to the Arc that aren't chapters. And then we have 30,000 or so individual members. So our network is pretty big, and we span most of the state with our influence and our reach. So many people look to us as a leader, as I'm sure they do with you, Leo, and you, Jordan, regarding anything that happens in the DD field. So I think that where we have established ourselves as a strong organization and a leader in the field is whenever significant things come up. So our response to this certainly has, or this issue certainly has been very significant. So we've had an opportunity to connect with many of our constituents on a level that we don't typically do, which I guess is kind of understandable. So families, individuals that were being served, providers, elected officials, we certainly have been busy on Zoom calls like this, meeting and discussing things with many of them. Related to COVID-19 and its impact directly on the people that we depend on or that we care about, we get updates, and we meet with our state division director, we were meeting 3 times a week. So every Monday, Wednesday, and Friday, they put together a stakeholder group to provide updates and discuss things that were going on, concerns, issues, really just to get feedback. So they would always report statistics and data. The last numbers that we got, I don't know if you're interested in this or not, but we had, this is as of last week, 194 positive cases for individuals receiving services. And out of those 194, we had 11 who had unfortunately passed away. As far as direct support professionals, so those individuals who work directly with clients, we had 170 positive cases and 3 deaths. So as far as data, that's kind of where we're at. I think that we've been happy, you know, although any case or anybody passing away is very unfortunate, but I think that considering where we could have been, we're not overly upset with those numbers. Our chapters and provider organizations across the state of Indiana actually did a very good job at making sure that their individuals were safe, that, you know, they all basically closed their day program sites pretty soon, pretty quickly in the process. So the overall impact on health has been relatively low, which is good. Let's see, the workforce, that's continued to be an issue. I think that initially, nobody had any idea what the impact was and the number of positive cases. So I think the first phase of our response and the work that we did was around trying to figure out what we would do as a state system if there was a significant number of people who tested positive. So there were contingency plans and many discussions and meetings about trying to figure out what that would look like, where residentially we would house people, conversations with local hotels and colleges and universities to find space so that individuals could go to. Luckily, we didn't have that issue. We didn't have a real high number in any location that we would need the extra resources. So I think initially, that's where all of our time, attention, and resources were. Kind of following that then, once things started to look like they were going to be okay, we started talking and planning for reopening. So we didn't get a whole lot of guidance, if any, really, from the state of Indiana related to what it would look like when we reopen. So they asked us, so the Arc of Indiana kind of worked with our state trade association on a series of meetings. So there were 3 stakeholder groups. We met with providers in Indiana. We met with individuals receiving services, and then also with families, just to get feedback from them related to what they were afraid of, what they were worried about, what they weren't worried about. So we got a lot of good feedback, a lot of good information that allowed us to pass that along to our state division. So the reopening process looks different for everybody. Each organization created their own reopening plan. I think the majority of the providers in the state were opening around June 1st. So we are about a week in at this point. We haven't heard any news or updates about any significant problems or difficulties with going back, although many people were very concerned about masks and the requirement for the individuals receiving services to wear masks. As we were planning for reopening, the issue of PPE became a significant conversation topic because nobody had enough. And I didn't even know what PPE was, to be honest with you, until this started. Our state, unlike California, did not have any resources for us or for our providers. So we too were kind of ranked pretty low on the priority list. But I don't think that we got anything from the state. I know that eventually toward the end of the crisis, they were putting together packets. So they had secured enough to give those out to businesses, but not at a level that made a difference for our providers. Most of them had to go out and get it on their own. The Arc of Indiana was able to help with that. So we were able to used some of our resources and also grants to purchase a pretty big supply of cloth masks. And they're in the process now of getting those delivered. Regarding Appendix K, I don't know how that ended up with your states. With us, it almost became a joke. Appendix K was brought up very early in the process, and the state actually did a nice job of providing some flexibilities that were included in the Appendix K application even before it was approved. So we didn't get approval for our Appendix K application, I think, until last week. So we were very late. It was good to see that it was finally approved, but at that point, I think that most providers felt like a little bit too little, too late. So let's see what else.
Well, that's going to be a big deal, I think, on the state execs meeting. It's going to be a good topic because I don't know. You said it got approved, but I thought ours was approved. But in fact, some pieces have not been approved because there's state plan services and there are waiver services. So we've had partial pieces approved. And today, because California was able to get retainer, that was the stuff we had talked about early on with Jordan, and he had the clearest picture of it. I think it's been really frustrating on our day in employment programs. And you mentioned it being a joke, Andy, so I'm assuming that there wasn't additional funding for day and employment programs through CMS?
Well, only recently, and not necessarily part of Appendix K. So as part of the CARES Act, so the state of Indiana finally pushed through some relief funds. So they are actually presenting it to providers in the form of grants.
Gotcha.
So, and I think, Jordan, you had mentioned that they were taking an average for the revenue that providers would have had. In Indiana, it's 75% of the average. So they're not being made whole, but that certainly helps and was welcome news to many of our providers in the last couple of weeks. So that actually came along late, and not that the Appendix K issue was a joke.
For listeners, let's just in case, because there are families on. So what we're talking about in shorthand is the federal reimbursement to states. And many of you know that that's an important part of all our advocacy, each of our states. For us, it's 50 cents on a dollar. My hunch is that's the case in Indiana and California, being economically pretty well off states. That's the most you can get. I think it's, 6% more right now because of the act. But, you know, it's a key issue because it affects what the state will do for state-funded services, right?
Yeah, absolutely. And so staffing, I mean, the workforce issues that were already significantly bad are worse right now than they were before. Jordan, I think, mentioned the unemployment issues, and that is affecting many of our providers and several of our chapters. So they are very concerned about having enough staff to figure out how to get through this. So I don't know, Leo, if you wanted to talk about future or later on.
Let's do that, and let's have a. I mean, clearly, you had so few cases. I'm sort of thunderstruck. You know, we had, I don't know, is it 1,200 with the virus in the residential setting? There's like 12,000 ballpark, and we had 82 people pass away as of the other day. You know, so. Again, small compared to this setting, but 82 is a lot of people that, and I know some of the people in that group are people with dementia and conditions like that, but still it feels approaching 100 people through the virus. On the other hand, we were nervous it would be a lot worse because Massachusetts has been really hard hit, and after New York and New Jersey. But yeah, your people going back to work without enough PPE, Jordan, you're just starting, right? Going back, and if that, right? Thinking about it.
Just starting, yeah.
Yeah. And we're a little more distant than Indiana. We're letting the trade sort of work through the day and employment and day hab stuff. And then we're working on some other things, trying to keep up with the family input. But they have small working groups, but literally they're meeting now, just as, you know, so I can't believe how much ahead of the curve Indiana is. And are people relieved, Andy, coming back?
No, it's a mix, really. The feedback that we got from both individuals and families, you know, they were all over the place. So some people are very bored and they feel pretty safe and secure, so they were ready to jump back in. Others were concerned about starting again, and some families had indicated that they wouldn't even be sending their sons or daughters back until who knows when, because they were concerned about where things are at. So a little bit of everything. I can say that most of our providers were operating off of a phased in plan. So the individuals that they had control of, either you know they lived in a group home that they owned and operated, or in a waiver residential setting, and they knew they were COVID free. The access to other people was relatively limited. So and they're healthy. Those individuals were the first group to come back, and then they would phase in the rest. So, you know, if obviously, you know, the older and more unhealthy individuals are, the later on that they'll be invited back to day programs.
Yeah, wow. How about Jordan? What are people? So Jordan mentioned the families. I don't know. Like, what's interesting is in our state, I worry a lot about them as well, because some of those are scared about sending loved ones back. Yet they're the ones that need the relief the most. What's happening in your planning as you look ahead?
In California, the reopening is, and Andy mentioned, his state isn't giving a lot of guidance, neither has ours, unfortunately, right now, on what reopening looks like. So similar to what Andy said, each organization seems to be making their own plans. And what we are hearing a lot of is staggered services. So, you know, you're not going to, if you had 100 people coming before, you're going to have 25 on this day and 25 on that day, and with the same staff during those days. And so you're kind of in your own little cohorts, just to minimize a little bit of the potential for virus spreading. So each organization is really coming out with their own plans right now, and we are trying to come up with some guidances and best practices, and incorporating what is being directives and guidances at the national level as well from the CDC, et cetera. So I think right now there's more questions than answers about reopening. It's changing very quickly. We continue as the ARC of California to push for some state guidance on this, but it looks like this is really just happening down at the regional level. County public health offices, counties are going to have a big role in this. Our governor has given the counties sort of their flexibility on providing guidances on how to manage reopening for especially settings like this. So it's really going to be at the local level where I think a lot of these decisions are going to be made.
Wow. There's a question about, now let me ask you, in your state, Jordan, isn't it the case that there are sometimes just day program only providers or employment only providers, or is it a mixed bag?
Employment only, or what was the other one, Leo?
Or day program. Like, in other words, there seem to be like a lot of providers that just only do day or employment services versus residential as well.
Yeah, they do seem to be segregated a bit. And if you are specialized in supported living, that's kind of what you do. Supported living, maybe you add respite. There's others who do mostly just sort of day programs. There are larger ones, though, who do a host of different things: supported employment, independent living, respite, and day programs, and do all of it.
Okay, so it is like the other states, all right. Probably people I met historically over the years. And then the question for Indiana, Mike asked if the day programs are slowly being phased in. I mean, you referenced some people being nervous, right, about sending people back. But when you opened, was it just come on in, everybody, on June 1st?
Yeah, no, certainly not. Kind of the way Jordan referenced it, I think they're trying to cohort or group people together so that they've got more control. Certainly social distancing guidelines are in place, so they've got to stay 6 feet apart. There's an added focus on hygiene and cleaning. Most individuals are required or strongly encouraged to wear masks. which has been an issue too. You know, I mentioned it a few minutes ago, but many of our individuals are not used to that. And so if they're prone to behaviors, they're getting very agitated, or if they have health issues, they may not be able to wear that anyway. So the masks are a big deal, making sure, you know, a lot of our organizations had their individuals go through some type of comprehensive training program, you know, where before they were able to run up and give somebody a hug. Now that's not an option anymore. And that's significantly different for many people from what they were used to. So lots of education, lots of training, lots of PPE, and certainly social distancing. And then also the phased in approach. So I don't think anybody just opened their doors and said, come back in. It's going to be a slow roll in until they're sure that people are safe and healthy.
Okay. I'm going to now ask you one at a time about the future. So we have need for PPE to keep buying. Who knows what your day settings are going to look like, right? Once everyone is fully, has full access. In fact, our special ed department just released a June 8th memo over the weekend, even though tomorrow's June 8th. I'm impressed that it came out today. It was supposed to be June 9th. I guess that's why I said tomorrow. Instead, it came out today. So they got it done early. And it's basically saying maybe there should be some in-home visits for people for the summer program for people with special needs who have more significant, you know, disabilities and or behavioral issues or needs. So I was impressed with that, by the way. But again, that's the challenge of masks or no masks. But as we look ahead, the need for more PPE, the need to, you know, spend money on the buildings, right? The transportation limitations, right? Cutting back. And the workforce crisis we began with in the first place, right? And the need to pay people more for quality work and to be there for the long term. What, you know, I don't have a specific vision right now, but I know things have to change. Yeah, right? So Jordan first and then Andy, you know, what do you, any ideas about how we get to that change and yet not indenture families for a lifetime of caregiver status? You know, how do we get there? And make sure people still have a good life, and not that it's ideal in homes right now, right? 24/7 homes. So, Jordan, you want to go first?
Yeah, and Leo, that is obviously, as you know, that is the question I think everybody's asking right now. Obviously, I think everybody's expecting that virtual supports and virtual services are going to become more integrated, and they're here to stay. In California, we're working on getting various types of remote services, not just being able to be billable during the crisis, but billable ongoing. So I think remote services and supports are here to stay. Obviously, we don't want to rely on them as much as we are right now, because they just don't provide all the support and the types of support that individuals need, but those are here to stay. And also, I think there's just going to be, there's already discussion in our state, and some are being a little opportunistic about it, which is unfortunate, but about the role of day programs, more congregate settings, and how do we ensure the safety, especially in the next year or two, of individuals into day programs. Do we have the capacity and the staffing to give more individualized one-on-one type supports, as opposed to you know, 1-on-8, 1-on-9, 1-on-10 type of supports in a day program? So I think those discussions are going to be happening quickly. Through it all, funding and money is going to be just key and crucial. I'm really concerned about losing staff as well. And Leo, you mentioned there was already in every state, California as well, especially, a staffing crisis here. The inability to pay the types of wages that are needed for this type of work, and then just a finding of people. I'm concerned that if we don't have the resources and the safeguards in place to ensure that staff feel they're going to be safe as well, that as we do reopening, there just might not be enough staff to provide that type of support ongoing as well. And a lot of that comes down to funding. And so In the short term, my biggest concern is how do we wean off of, if in California we have retainer payments, Andy's saying they're paying 75%, but if we know that we're not going to have, let's use day programs as an example, or supported employment in the same way we were a few months ago, it's not going to be turn on a switch and now everybody's back. How do we thoughtfully, intelligently create a funding mechanism over the next 6 months, a year, where we don't just, programs aren't closing, we're not just losing capacity right away, but we're allowing a transition and we're allowing capacity to stay there, while even though all the people might not still be coming to different types of programs and services. So those are a lot of things we're thinking about right now. And again, I wish there were more answers and questions, but I think it's the other way around, unfortunately, right now.
Thank you. Yeah, Andy, you want to add to that? Jordan, thank you. Yeah, it's a lot of questions, right? No clear ideas yet. I mean, well, and that's good. We're being open, right? Let's put a good spin on it. Andy.
Yeah, a lot of the same things. I mean, obviously, telehealth, telemedicine, virtual programming, those are all opportunities that have increased significantly. And it's been interesting. Some of the feedback that we've gotten and our state has received is that that's been a good thing for a lot of people. So there are people all over the state who had either been in a sheltered workshop or a day program, and they were in their 70s and they wanted to retire. They didn't want to keep going and participating in day programs at a facility. So for them, this has been a welcome change and something that they'd like to see continue moving on. So I know that our division is looking into that and considering that as something that they can include as part of the new Medicaid waiver rewrite and redesign. So that's been a good thing. Financial impact on our chapters and on providers all over the state, of course, has been significant. So as the Arc of Indiana looks at the future, and Kim and I had a meeting this morning with one of our pretty large chapter providers about mergers and acquisitions. So there are a lot of small to medium-sized organizations, even the larger organizations, who at the beginning of this had a healthy reserve of cash and weren't all that concerned as it played out and extended and opening was delayed. They were worried too. We did a survey not too long ago about the expected financial impact, and all but one of our chapters expected some type of significant negative financial impact, and many of them expected closure of programs or significant changes to their overall structure. So I think long-term, looking forward, you combine just the financial impact of this with the issues that we were already facing as an industry, the workforce crisis being one. And I think that a lot of our providers are afraid. I think that anxiety then flows down also to our constituents, the families, and the people who are receiving services. I also, the Arc of Indiana maintains a foundation that's very focused on employment opportunities for people with disabilities. We've got EGTI, which is a comprehensive training program that over 200 people have gone through since it started 5 years ago. And we've got typically an average of 82% of our graduates are working in the community, which is fantastic when compared to the typical employment rate for our population. We did a survey among those graduates, and 60% of them either lost their job or were furloughed. So if you extrapolate that out to the whole state, we've literally have thousands of people right now who were working in their communities and now who are no longer employed. So I think that's where I keep pushing Indiana. I think that we're doing a decent job at this point, and our division has been great with communication, maybe not recommendations, but they've certainly listened. So I think that we're in a pretty good place with day programming and getting things back to normal, but I wouldn't say the same thing about employment. So I think that we've got a ways to go. The conversation has started, but it's not gotten too far yet. So I'm kind of anxious to see where we go there. And I'm anxious also to hear from Jordan and Leo how you guys are doing with the employment stuff.
Jordan?
Yeah, it's a huge concern for us as well. And we have heard a lot of the same thing of individuals losing or being furloughed from their employment. We've been lucky in that some of the retainer payments that individuals have used, if the payments were actually coming through the provider, then the provider is able to continue to pay that individual. Same with PPP. However, the concern, we're looking at possible ways to incentivize rehiring. We're going to start talking with in the next legislative session on tax benefits for rehiring of the population, tax incentives. And, but at the same time, we know that when it's very difficult and the employment rate is high, that makes it much more difficult for our community to place their jobs or to retain their jobs. So we're going to try to find systemic ways to incentivize employers to hire back the individuals. At the same time, we know we're going to be rolling out shortly here, we're going to be working on a campaign as well, just to bring awareness to our own provider community, families and individuals about, hey, now is the time, let's put some energy into this specific issue about getting the individuals reconnected to their employers or reconnected to other work opportunities.
Right before this happened, we had a subcommittee on employment working at the legislature. So that was pretty cool. And people did lose their jobs, except for those in essential work roles. A lot of people anecdotally, I don't have any clear study on it, but I can tell you also recently, anecdotally, a couple of my colleagues said, hey, we're getting calls. People want the folks back at the jobs. So again, that's anecdotal. My hunch is it's going to take, it's taken a hit, and we have to do things like both of you are talking about to ramp up activities. So when you think about what's ahead for us, there's ramping up that activity. There's reconnecting with people. I like the idea of tax incentives. There's going to be the big funding gap, right? In Indiana, I heard it was 15%. In California, 56 billion, right? Is that right? 54, something like that.
Yeah, 54 billion. Yeah.
Our tax date was extended to July 15th, so that'll be the bellwether for us in Massachusetts, along with the federal issue, right? How much more bailout there is, stimulus, and how well we reopen. I do think we need a strategy that is sort of like money follows the person. I think, I don't know how we get there, because, you want to keep a stable service system, right? And we all work with chapters and other providers that are worried about their future. We don't want chaos to happen in the safety net. People rely on them. So how we do that without, one of the state reps is very close to us, and a leader said, with change in a time like this, you have to be careful. People get fearful, and there could be anxiety, even more anxiety. And so I'd say that, and trauma-informed care and trauma-informed advocacy, I guess, is the next week. We're going to have 2 one-hour sessions back to back, directed at staff for trauma that they've gone through, but families are invited to attend to. We're going to cap it at a certain number of people, but we'll do it again if people clamor for it. But I think working together, as we do all the time, is going to be really important to gain strength from each other. And let's take a couple of minutes. We're supposed to close at 45 minutes, but just in case some people have more questions. I know they've been answered, a bunch of them. Carrie, is there anything else? Anybody want to add anything? And
yeah, so actually I have a question for Jordan and Andy. So, it's been for families who have their loved ones in congregate care. It's been really, really frustrating because they have not been able to visit or see their loved ones. They're allowing FaceTime and, different Zoom technology, but no visits in terms of, being able to spend time. And I'm just wondering if Indiana and California have made any headway in that, and how did you start, and, what's it like now?
I'll go ahead and start, Jordan.
Okay, go for it.
So in Indiana, each organization is continuing, or from the beginning, they worked on developing their new policies and procedures and protocol. So obviously this was new to everybody. I don't think anybody was quite ready to figure out how to handle that part of it. So in Indiana, at least, there has not been any guidance or stipulations from the state on how to handle that. Although the question comes up and the response is, you maximize virtual opportunities and get creative with how that happens. And that's fine for many of the people receiving services and their families, but it doesn't work for everybody. So each of our organizations have created their own policies and procedures. Visits, I think, have begun in some capacity. They don't look like they did before, but they're each dictated, they decide how to handle that. And so it's been a constant conversation. We've gotten a lot of feedback at the ARC about concerns and complaints. And so I understand the question. Unfortunately, I don't have a blanket response, or probably even a good response, other than our organizations are figuring it out on their own and implementing their own protocols on what that looks like.
Yeah, and in California, it follows a lot of the same lines that Andy was talking about. We've seen in residential settings a host of different strategies kind of deployed during this time. We've even seen some staff who have been willing at the beginning say, I will go 6 weeks and isolate myself in this group home and not go to my own home. And we've seen that across the state. We've seen some places where family was able to come and go, others not. And so unfortunately that hasn't been a statewide directive of any type. It really has been location by location, and each trying to find ways to mitigate risk by themselves. So there hasn't really been any consistency in the state on that, nor has the state gotten involved in that. In a similar point, we were happy that there was a big push for, and I think Leo was a big part of this, getting families the right to visit their loved ones in the hospital if they're hospitalized due to COVID. And so we were able to follow on the heels of what Massachusetts and New York did, and we passed that as well, to be able to visit individuals when they're in the hospital. But you're right, during residential settings, it has been inconsistent in our state, and we haven't really seen any guidance on how or when that'll become uniform or changed.
Okay, thank you both. Interesting. Alice has a comment. Has anybody thought ahead to summer vacation? So in Massachusetts, if an individual leaves the group home, they can't return until this is over.
Wow. So I guess I would have a question. How do you define when it's over? What does that mean?
Right. Well, we're
Good
worried
question.
it'll be stage 4 or something. We're worried it'll be like 2 to 3 months from now. So that would mean Carrie's point is, Alice's, I'm sure, is I bring my son home, or we go to Maine or Cape Cod, and then they're not going to accept him back until he gets a test or whatever, and or maybe whatever. Maybe I'm being too optimistic with the test being enough. That's not been addressed. And so there's 2 things that haven't been addressed in ours. Our policy was just released this weekend from the state, and there's no person-centered aspect to it. So if someone has trouble with embracing, right, and wants to embrace their loved one, they'll just be told, sorry, you can't have a visit, which feels a little stiff. And then there is nothing about this at the present time. There's outdoor visiting as the guidance, basically, with social distance. So we have some more work to do on our end, and And I get it. I mean, people are following the governor's, you know, whatever state dictums you have. I'm sure providers are looking at that. But that doesn't really answer. This is unusual situations, right? Unique. They're not the typical situation. Anybody else?
So Leo, yeah, Christine had a comment, a question. Is there any experience for Andy and Jordan that they can share about testing individuals and staff?
That'll have to be the last question.
Yeah, our testing has been somewhat inconsistent from region to region in California. It's been very inconsistent from region to region. A lot of that falls down to the counties as well right now. And so there isn't kind of a single answer I could give on what testing does look like. I know that definitely in nursing facilities, there has been a much more aggressive approach to testing. In residential settings, group homes for our community, not so much. So there isn't really a blanket, across the board approach that the state has been taking for testing for staff. We're hoping that as testing becomes more available, that especially for the group home settings, that we can have staff, especially as they're coming in, have testing available.
Yeah, I would say Indiana is relatively similar, so I think it's pretty regional. I know that in Indianapolis, tests are relatively available, and I haven't heard of too many issues there. Obviously, in our rural communities, or the farther you get away from Indianapolis, it becomes a little bit more challenging. One thing I would say, though, that our state did well, they implemented or instituted what they called, I think they were rapid response teams. And so if there was an issue or a potential issue at a group home or a nursing home or some other congregate setting, the state of Indiana would send out a team to kind of analyze and assess the situation, do testing, and then make recommendations. So I know that a few of our chapters took advantage of that and had a lot of really good things to say about it. But overall, it's kind of hit and miss with testing. For a while, we didn't have enough, and then now they seem to have caught up. But I'm not sure that statewide, it's as good as it needs to be.
I know it would make sense in a big state like California to be even harder to pull it off. And look, I want to thank you all. We should really wind down. This has been great. Jordan, Andy, thank you so much for being on. It's great to see you guys visually. Yeah, and people, I think, really enjoyed it. Very few people got off early, so clearly after past time. So thank you, and look forward to being in touch. And everybody else, thanks for being on. And tomorrow, Kerry has, I think, the Bolani's on, right? And Thursday, and we stop Friday. I got to take Friday off. So Thursday, there'll be a cultural intersection session with someone who's done cultural competency at our Yale School of Nursing program with Maura and Ellen. So thank you again, and catch you guys soon.
Absolutely.
Thanks, Leo.
All right. Great to see you. Thanks. Bye-bye.